Minocycline drugs information. Look at this picture, shows that generic name minocycline, drug class tetracycline antibiotics, brand name Minocycline, Dinosine, etc. What is minocycline? Is a broad spectrum tetracycline antibiotic used to treat various bacterial infections. It works by inhibiting the growth of bacteria, thus preventing them from reproducing and spreading. It is commonly prescribed for infections such as acne, respiratory tract infections, urinary tract infections, skin infections, gonorrhea, chlamydia, tick-borne infections, example Lyme disease, meningitis in some cases. Minocycline is also used for its anti-inflammatory properties in treating conditions like rheumatoid arthritis. Vital information 1. Pregnancy category D. Minocycline may cause harm to an unborn baby and should be avoided during pregnancy. 2. Lactation not recommended for breastfeeding mothers as it can affect bone and teeth development in infants. 3. Age restrictions not recommended for children under 8 years of age due to risk of permanent tooth discoloration and bone growth issues. Before taking or precaution before starting minocycline, inform your healthcare provider if you have 1. Liver disease. Minocycline is metabolized in the liver and impaired liver function may require dosage adjustment. 2. Kidney disease. It may require dosage adjustment as the drug is also excreted by the kidneys. 3. Allergies. Any known allergies to tetracyclines or other antibiotics. 4. Autoimmune diseases. Prolonged use of minocycline has been associated with lupus-like syndromes. 5. Pregnancy and breastfeeding. Minocycline can affect fetal bone and tooth development and it can pass into breast milk. Also avoid prolonged sun exposure while taking minocycline as it can increase sensitivity to sunlight leading to sunburn. How to use? Take this medication exactly as prescribed by your doctor. It can be taken with or without food, but taking it with full glass of water is recommended to avoid irritation of the esophagus. Avoid taking andesites, iron supplements, or calcium containing foods like dairy products within 2 hours before or after taking the drug, as they can reduce its absorption. Drugs information. 1. Adult dose for acne. Initial dose 200 mg orally, followed by 100 mg every 12 hours. 2. Adult dose for bacterial infections 100 mg orally every 12 hours. Miss dose. If you miss a dose, take it as soon as you remember if it's close to the time for your next dose. Skip the missed dose and resume your normal schedule. Do not double dose to catch up. Overdose. Symptoms of an overdose may include severe dizziness, nausea, vomiting, difficulty breathing if an overdose occurs. Seek emergency medical attention immediately. What should avoid? Do not stop taking minocycline without consulting your doctor even if you feel better. Stopping prematurely can lead to the return of infection or resistant bacteria. Avoid prolonged exposure to sunlight or tanking beds while taking minocycline, as it can increase sensitivity to UV light. Side effects. Common side effects include nausea, vomiting, diarrhea, dizziness, lightheadedness, skin rash, increased sensitivity to light, discoloration of skin, nails or teeth, changes in mood. Serious side effects: autoimmune issues, drugs induced lupus, liver problems, intracranial hypertension, persistent headache, visual disturbances, severe allergic reactions, anaphylaxis, skin rash, infection overgrowth. Long-term use can lead to yeast infections, antibiotic resistance. Other drugs will affect. Certain medication can interact with minocycline and reduce its effectiveness or increase the risk of side effects. Andesites: aluminum, magnesium, calcium containing andesites can reduce absorption. Iron supplements: decreased absorption of minocycline. Blood thinners: Minocycline can increase the effects of warfarin, other anticoagulants, leading to increased bleeding risk. Isotretinoin can increase the risk of intracranial pressure. Penicillin antibiotics. Minocycline may reduce the effectiveness of penicillins. Always provide a full list of medications to your healthcare provider before starting minocycline. Thank you. Have a nice day.